So how do we develop a generic measure? There's about three main stages. First of all, we need to develop a descriptive system. And of course, this involves a huge amount of qualitative work discussing with a range of individuals and stakeholders and primarily patients what dimensions are important to them. And so you develop a descriptive system of health. And the EQ5D is a very simple descriptive system with only 5 dimensions: mobility, usual activities, self-care, pain, anxiety and depression. Now, once we've got the descriptive system, we need to do some kind of survey where we confront respondents with various health states or various health state descriptions, and we get them to value those health states, value time spent in those health states. And we use something like, well, for example, a time trade-off question, which I'll be showing you, to get this valuation. The final step is taking the data from our survey, which gives us some information on how this group of patients or the public or whoever have valued these health states. And we want to go from that to a general algorithm or formula which allows us to associate a score with every health state in the descriptive system. So that's 3 stages. First of all, develop a descriptive system. Secondly, in a survey, you collect some data scoring some of the health states in that system. And in the final stage, you model these scores so you can predict a score for any health state. This will become a little bit clearer as we get on to some examples. So, generic preference-based measures. This is just to remind you, EQ5D, I don't know if Cher's in it, but it's a world leader. It's the big one. SF6D, it's there. The HUE3, the most recent incarnation of the Health Utilities Index, is quite important. Otherwise, the other measures are not widely used. So, the EuroQAL or EQ5D, it's called the EuroQAL because researchers from about half a dozen European countries collaborated on it. And of course, it's a marketing ploy, it's a brand. Far better to have a catchy name like that. The qual bit, I think in passing, quality of life, again, that's almost a branding issue. We're not measuring quality of life. Quality of life has so many different dimensions to it. It'd be bizarre if we thought we were measuring quality of life, but that's just what it's called. Sometimes people refine it and talk about health-related quality of life. Personally, I don't think that's very helpful either, because I don't know what's health-related and what's not health-related in terms of quality of life. But that's the terms that from history, we've been left with. I try and think of these things more as health state values, or simply numbers we attach to health state descriptions which represent the relative goodness or badness of time spent in that health state. Now, of course, it's a lot easier just to talk about quality of life, but it's not, that's just a label, okay? EQ5D, incidentally, is preferred by NICE, the organisation in England, which has got quite a major role in utilising this approach. They actually go as far as to say in their methods guide, they want to see the EQ5D used. That's not a reason for preferring it, but that's just a factual statement. The original EQ5D had 3 levels, and therefore is more accurately called EQ5D 3L, 3 levels. So by 3 levels, I mean each dimension, for example, mobility, there are 3 possible responses you could make. Now, that is so minimal. This should appeal to a Chinese audience culturally. It's so minimal. 5 dimensions, 3 levels. It was developed this way, I think, because the approach was very much to get something off the ground, something into use. And don't be too ambitious, don't go too big, don't make it too complicated. So 5, that's easy. 3 levels, simple. And in the sense that it's become established and quite widely used, it's been successful in that aim. I'm not convinced that we can really capture differences, all the important differences in health state, simply with 5 dimensions, or particularly just with 3 levels. That's where we've started from. In recent years, a 5-level version has become available, the EQ5D5L, and the idea being by having a slightly richer range of responses, you're going to get richer information. And it's really quite likely, it hasn't happened yet, but it's quite likely that it will supplant, the 5L version will supplant the 3L. And it's been the case, because it's been coming for a while, that quite a lot of clinical trials have been collecting the 5L data. And so in recent years, it's been less common for people to start collecting 3L. So what does it look like? Well, this is it. It's not any more complicated than this. The question that people are asked at the outset is, by placing a tick in one box in each group, please indicate which statement best describes your health today. So it's not which statement is an absolutely accurate description of where you are, it's which is best. So which, if you like, even which is the least bad, which of these is closest to where you are today. And for mobility, the 3 levels, I have no problems in walking about. I have some problems in walking about. I'm confined to bed. Similar structure for most of the others. Self-care, no problems, some problems. I'm unable to wash or dress. And similarly, pain, discomfort. No pain, moderate pain or discomfort, extreme pain. So it's very crude. And individuals simply tick the boxes. It doesn't take long to complete at all. And the health state we've got illustrated here gets labelled, for obvious reasons, 2112, because this individual has indicated they have some problems walking about and are moderately anxious or depressed, but otherwise no problems, hence the 2112. There are 243 ways to fill in this questionnaire. Well, this is not allowing for writing rude comments or whatever, as one does, or as one might do in elections. But different acceptable ways of filling in this questionnaire, 243. And it's 243 because that's 3 to the power of 5. And so it's based 3 levels, 5 dimensions. So just think about that. 243 ways makes, what's that song about? Something, 20 ways to leave your lover or something. Or I can't remember. Anyway, 243 ways to describe your health. Is it enough? Well, the strange thing is, you can survey quite a large group of patients and only a small subset of the 243 ever crops up. So while your first instinct might be, this is so crude, it can't be an adequate way of characterizing people's health, you might think there's some support for it, given that we see the 243 options don't get used. A much restricted set gets used. The 5L, well, obviously it's got 5 dimensions. I've just reproduced the mobility dimension and anxiety and depression here. So mobility, I think, is quite clear. We've got a potentially better measure here now. No problems walking about, slight problems, moderate, severe problems, I'm unable to walk about. In the old one, that I'm confined to bed, was just so extreme that it probably wasn't very helpful. Anxiety and depression, and also this wording goes rather similarly for the pain one. Not anxious or depressed, slightly, moderately, severely, extremely. Now, in the surveys in England, some individuals seem to have had a little difficulty distinguishing between severely depressed and extremely depressed. They didn't seem to have this problem in the Chinese version. So maybe linguistically, the difference between the Chinese equivalent of severe and the Chinese equivalent of extreme is much more transparent. I don't know. But certainly in England, there's some evidence that respondents found that this distinction between severely and extremely slightly challenging. By contrast, what does the AQAL look like, assessment of quality of life? Well, there's an AQAL 4D. The dimensions are independent living. That's a little bit like self-care. There's mental health, that's very similar to anxiety and depression. There's relationships, that's maybe a little bit different. And there's senses. Now, one of the criticisms of the EQ5D is with respect to people's senses, such as sight or hearing, it's not obviously a very good measure. So that might be a strength of the AQAL. There's a 6D where they add in coping and pain. There's a 7D where we add in visual impairment, and even an 8D where we add in, we've got 6D plus self-worth and happiness. Personally, I feel this smacks of a lack of confidence about what you're trying to measure, and they're trying to sort of cover all bases. They're trying to, you could put it more fairly and say that they're going to have quite a narrowly defined measure and a series of more broad measures, and they've got open minds as to what they're measuring. Developed and largely used in Australia. Valuation is a combination of time trade-off and visual analog scale. A visual analog scale is simply a line, usually with equal segments, and you ask somebody to score themselves on that line. Not thought a very good measure generally. So that's AQAL. HUI, the Health Utilities Index. Has any of you seen The Godfather, a trilogy of films? Well, you've never seen Godfather 1, have you? Because it's The Godfather, and then you get Godfather 2 and 3. Well, Health Utilities Index is just the same. So you don't start by having an index that's called HUI 1, Health Utilities 1. It's just the Health Utilities Index. And then over time, you get your sequels, the HUI 2 and the HUI 3. The HUI 3's popularity, relative popularity, I think is down to including cognition, vision, hearing, and speech. Because there are some health conditions where these elements are going to be quite important. EQ5D doesn't have that. Otherwise, back to our little statues outside Tokyo Tower, we've got ambulation, that's just mobility again. We've got pain again. Emotion is probably anxiety and depression.